There are serious concerns drug and alcohol addicts will have few rehab beds to go to after government funding cuts. Welfare groups say South Australia already has the fewest rehab beds in the nation, with another 40 going next month. Caroline Winter reports.
I played in an orchestra when I was going through school and hocked my own cello, pawned it and lost it. And just recently I've been able to buy myself a new one.
Kendall Silsbury has been to hell and back. What started as experimentation and self-medication for anxiety became a full-blown addiction to alcohol and drugs.
Found myself with a significant heroin habit. I was smoking. I thought that because I was smoking it, I wasn't using needles. It wasn't as bad, but I had a raging habit, probably about $400 a day, and I would lie, cheat and steal to get that.
The cost was more than financial. She lost her job as a teacher and her 15-year relationship broke down. 2 of her 3 children walked away and she found herself homeless and alone. Kendall Silsbury is now 8 years clean and very aware of what could have happened if she didn't get help.
I think I would probably be in jail or dead.
It was the Salvation Army's drug and alcohol rehabilitation program at Warrondi in the city, now known as SARS West, that saved her.
We see lots of people make changes, good changes, but we also see lots of people fall back. And some, of course, don't make it because it's also a lethal addiction, often.
The 20-bed residential facility had its state government funding cut 5 years ago. Fortunately for Kendall Silsbury and others, it survived, thanks to the backing of a private benefactor and more recently the Salvation Army.
If it wasn't for this place, I'd drink myself to death.
The program saved my life. I had long-running abuse issues and been a heroin addict most of my life.
Good morning, Michael. How are you, mate?
Hello, Paul. Paul Colson says while his organisation has kept it going, it makes more sense for the government to fund it.
It's actually a false economy not to be giving these people intensive services, because people who access lots of other services because of their alcohol and drug addiction cost the community millions and millions of dollars every year.
The state's peak non-government drug and alcohol body says dependence on those other services is set to rise.
We're about to lose 40 or 50 beds come the 1st of July. The figures aren't clear because the service agreements haven't been finalised, and that will leave a big hole in services for individuals, families and communities.
Andrus Banders says the latest round of state government tenders and cuts to Commonwealth funding will slash beds in South Australia from 90 to about 40, adding extra pressure to an already stretched health system. For 30 years, Paul lived a foggy existence.
Christmas was probably my lowest. This Christmas just gone. I was losing contact with my family and my daughter especially, and I was losing my friends.
In January, Anglicare's Archway program helped him end his battle with the bottle.
Even though I am 50 and I left it this late, I believe I've got a better future now because of Archway and the counsellors here.
Paul will be one of Archway's final success stories. The program's funding has been cut, and after 54 years it will close with the loss of 24 beds.
I think that there will be a loss of opportunity for people once they've gone from the withdrawal units to have facilities that they can go to for a period of time in order to stabilise themselves to go back out into the communities.
Anglicare says it's looking at other models of care in the future. But right now, options are limited, with Kaipo community at Wollonga also shutting its doors.
While the Kaipo model worked for some clients, there were some clients within the society that we just weren't meeting.
The 20-bed rehabilitation facility is being replaced with 12 residential beds across the suburbs. Daniel Moss from Uniting Communities says they wanted to focus on those who can't wait 5 months for a long-stay accommodation. but concedes it means 8 less beds.
There is a lack of systems and a lack of funding for drug and alcohol services in this state, and there are many reasons for that, but unfortunately individual services can only cater for what they're funded for.
The state government has funded 6 new drug and alcohol rehabilitation beds for young people through Mission Australia and continues to run its own 24-bed rehab facility, the Woolshed. Welfare groups say Indigenous drug and alcohol services are also missing out, especially after the federally funded Calparin at Murray Bridge closed this year with the loss of more than 20 beds.
We know that some services need culturally specific attention. They need Aboriginal workers that are trained and skilled in this particular area, and there just aren't enough of those options available.
Despite claims there'll be up to 50 fewer rehab beds come June, Drug and Alcohol Services South Australia has told 7:30 SA it doesn't anticipate the current number changing, although contract negotiations are yet to be finalised. DASA also says the non-government sector can expect to receive $6.8 million to spend on services this financial year. The Federal Department of Health and Ageing says cuts to 6 SA drug and alcohol projects have been reinstated after gaps in the system were identified.
Good morning. What can I get for you? Coffee, please. Coffee?
Kendall Silsbury has reconnected with her family and now wants to help others struggling with a drug or alcohol addiction. But she fears for the hundreds left waiting for a residential rehab bed, just like the bed which saved her life.
With the practical help that they were able to give me, that there was a chance that I would be able to sort things out. I knew I couldn't do it by myself.
Caroline Winter there.